This should change how you see a doctor's roles and responsibilities. In emergency medicine, we're trained to rule out dangerous pathology, and that skill is obviously very critical because it saves lives. But what social media has taught me very clearly is that ruling out life-threatening diagnoses is only a part of what patients actually need. Take low back pain, for example. It's one of the most common reasons that people come to the ER, and our job as doctors is to identify red flags that suggest serious pathology, like cauda equina syndrome, fracture, infection, or cancer. And once those have been ruled out, it can be very tempting for a doctor to quickly reassure a patient, recommend things like Tylenol and Advil, and move on to the next case. And clinically, that's actually often appropriate. But what I've learned from reading your comments is that reassurance alone is rarely enough. Patients want to understand why they're in pain, what's happening physiologically. They want to know what they can safely do and how to prevent it from happening again in the future. They want context. Social media has sharpened my awareness that explanation is not an optional add-on to clinical care. It's a part of the treatment itself. And one of the most fascinating things about social media is that before this existed, there was a much wider gap between patients and providers. And outside of a complaint process, there's almost no mechanism for feedback on how to improve. And now that I have this platform, I get to hear directly from hundreds of thousands of people about what they felt was missing in their care. So if you follow me, keep sharing your experiences and perspectives, because many doctors and nurses follow me and read these comments too. And this has made me more intentional about how I practice medicine, and I suspect that it has a similar impact on others, because communication is not separate from clinical care, it's central to it. And that's why